Welcome to Practice Makes Purpose, the podcast where we connect with JMU Nursing alumni who are making a difference in healthcare and beyond. I'm your host, Caitlin Billman. Today, I'm honored to welcome Leslie Lantz, class of 2003, an accomplished nurse educator, researcher, and proud JMU alum. Leslie brings over 2 decades of experience in maternal child health, nursing education, and clinical leadership. She's currently pursuing her PhD in biobehavioral research at Virginia Commonwealth University, where she is contributing to impactful studies on maternal mental health, nurse well-being, and perinatal substance use. Earlier this year, Leslie returned to JMU as our White Coat Ceremony speaker, and today she'll share more about her journey, her research, and her passion for shaping the future of nursing. So, let's dive in. All right, Leslie, well, thank you so much for joining us. I'm really excited to have you here. It's super, this project has been really fun to set up, and I'm glad to have you.
Yes, it's a pleasure to be here, and thank you for asking me to join.
Of course. Well, let's start off. You were our speaker at White Coat this year. What did it mean for you to come back and encourage our students who are starting their nursing school journey?
So I was honored and privileged to be able to come to the White Coat Ceremony at James Madison, and I am just such a committed and just enthusiastic alum. I graduated from James Madison University's nursing program in 2003, so like a really long time ago, 22 years ago. It's hard to believe. And I also had some pictures from that were rather nostalgic, but back then we didn't have the cell phones to be able to take those pictures. So they're kind of, just printed off ones. But anyways, it just, oh my goodness, it meant so much to me. And I just was so honored to be able to come and speak to those that are newly embarking upon their nursing journey. And so really, I was very touched and blessed to be able to speak specifically about compassion in nursing and just how instrumental that really is within the nursing profession, and how that it's really just, I feel like truly the heartbeat or the very heart of healing as we're providing care for our patients and our community and even just the world at large. So really, anyway, I just felt like it was a very inspiring opportunity to be able to come and celebrate this great achievement with them and just to feel their synergy.
Yeah, absolutely. I'm sure a lot of our students were encouraged. I mean, compassion is so important in nursing and in everyday life too. So it was really, really awesome to kind of be able to hear you speak. How has your experience at JMU kind of shaped your career path, especially now that you're pursuing your PhD at VCU?
Yes. So really, JMU's nursing program just provided such a foundational sort of for everything in the nursing profession, but even beyond that. So I started at JMU as an 18-year-old and certainly had a lot of growing and developing and learning about myself. And so JMU really helped to cultivate that. But it also provided just such a strong instrumental foundation for entry into the nursing profession, and also really a commitment to the community. And JMU is very big about that. They really emphasize that and just really promoting lifelong learning. So I'm so appreciative for that. And the other thing was that they were very committed. All of the faculty, really the student body, had this sort of synergy about holistic and patient-centered care, which thankfully that has, continued over the past 22 years, at least for me, but I'm sure that it's been even longer than that for others. And I think that that's really important, but also really inspiring students to be lifelong learners. And that has been really huge, especially now as a PhD student finishing up coursework. And so it's been quite a while since, 22 years. And I got my master's of nursing and education. And that was through Walden University while I was working full time in the emergency department and in women's health. So doing that when my two of my older children were younger. And so anyways, just really reflecting back to how much JMU was just so instrumental and inspiring to be like, okay, you know, your education and your learning moves beyond your graduation here, and you really need to think about how you can positively impact the lives of others, and how that we have the capacity and the ability to be able to do so, not only for our patients in the community at large, but also how we can make a positive impact in the nursing profession.
Yeah, that's so cool. I love the lifelong learning. I personally love, learning new things, and it's really cool doing this podcast because I'm able to learn about different nursing professions. So that's really cool. You've had such a rich journey from bedside nursing to academia and now in research. So what inspired your transition into nursing education and research?
So I would say that my bedside nursing experiences, so some of that, well, it really fell within sort of three specialties. So emergency medicine, pediatrics, and then women's health. So anywhere between antepartum or during pregnancy, intrapartum, the laboring process, and postpartum, and then the well nursery. So really that over the years of also being enveloped in those specialties, but also the kind of the lived experience of being a mother of 4 children, I think that just really helped to solidify my commitment to really thinking about that high quality and compassionate care, and how could I bring about the biggest or the a larger impact, positive impact. And so I just remember and reflect upon the faculty that I had at JMU and just how inspirational they were to building my foundation as a nurse. And so they shared these insightful stories, and they just had this synergy, and you could just tell that they were really passionate. And just really thinking about, oh my goodness, like I'm living the some of those key learnings and lessons and those types of things through them and their expertise. And so that I just thought, gosh, that is so important. And I feel like I have some things that I can also contribute to the future. And so I really started nursing education almost 10 years ago. So it's been almost a decade. And, pre-COVID, COVID, post-COVID, I mean, there's been quite the spectrum there. But I will say that I really had a rich experience here within my own community with Rappahannock Community College, and had the privilege of teaching there for 6 years in their LPN to ADN, and then their ADN programs. And so it was just phenomenal. And I really gleaned a lot of great experiences, but it is so, and then of course now I'm at Virginia Commonwealth University, teaching in their undergrad, and I do clinical, lab, simulation, classroom. But I'll tell you, it is so rewarding to be able to see and meet students where they are, and just where they feel so comfortable to be able to say, I feel like this is an area that I understand well, but I'm not feeling very strong here. Can you help me facilitate and grow? And so really thinking about from JMU days, like this is how my instructors would probably approach that. These are the things I learned from them. And then that, kind of compiled with the bedside nursing just really underscores the importance of how I as a nurse educator can really contribute to making a positive difference in our nursing profession, and how that exponentially grows. So I would say probably over the past, almost 10 years of being in nursing education, I've had hundreds of thousands of students that I have made, contact with, whether it was in the classroom or clinical and those types of things. And it's just so rewarding to be able to see them graduate and become nurse professionals, and some of them have become nurse practitioners or PAs, or they've earned their doctorates. It's just it's really breathtaking
Yeah.
to think about. But yeah, it's that was really huge about inspiring me, and it really helps to keep me anchored in nursing education, just knowing that I within my own self can really help to contribute to really the larger goal of being able to enhance the nursing profession and humanity.
That's so cool. What a cool like full circle moment to be able to kind of give back and the experiences that you had as a student to inspire your students. That's just really cool. So about your research, can you tell us about your Mindful Moms study and what excites you the most about its potential impact?
Absolutely. So I can't take credit for Mindful Moms. Mindful Moms I serve as a research assistant, and I had the privilege of doing a sub-study within the Mindful Moms study. So I'll start by saying that. But the Mindful Moms study is absolutely phenomenal. Dr. Patricia Kinzer, who is our current dean at VCU School of Nursing, she is my PhD mentor, and she is one of the PIs or principal investigators for the Mindful Mom study in partnership with Dr. Susan Bonner-Duran, and her space is within sociology, and she's also a PI for this study, has been just phenomenal. So really the Mindful Moms study, it's getting ready to conclude, but it's a 5-year NIH funded grant. And really what it did was it focused on looking at underserved, under-researched populations, pregnant populations, specifically those that were identified as being marginalized. So maybe lower socioeconomic status, maybe they've had high school or less regarding education, or they meet the qualification of being eligible for WIC or women's, infants, and children's sources, those types of things, and really looking at sort of like a well representation of ethnicities and such. So really it's just a very robust study, and it was a 2-armed longitudinal randomized control trial of an N size or participant size of 200 total. So you have your intervention, which is the Mindful Moms component, and that Mindful Moms part is really focused on its group-based mindful physical activity through prenatal yoga. And then there was an active control group, and they really focused on prenatal education. So this occurred really during pregnancy. Usually the participants were enrolled around their first or second trimester. And so anyways, they were randomized to this Mindful Moms intervention or the active control group. And then they would participate once a week for 12 weeks. And this also occurred during COVID. So there was this huge transition, from being in person in small groups and being able to participate depending on where participants were, whether they were designated in the intervention or control group, and then having to transition to online and those types of things. Unfortunately, I wasn't at VCU during the heat of COVID, right. But really the Mindful Moms study follows these pregnant individuals throughout the trajectory of their pregnancy and up to 6 weeks postpartum. And they're really assessing symptoms or experiential depression, anxiety, and stress. They also look at epigenetics through maternal DNA methylation and do blood draws at 6 weeks postpartum in the mothers. And so anyways, it was just really just phenomenal. I had the honor and privilege of working with Dr. Kinzer, and she was just so instrumental. Her and Dr. Amy Salisbury, who is our Associate Dean of Research and Innovation at VCU. And so anyways, really working with them to apply for an intramural grant funding through the VCU School of Nursing. And I was just so honored and privileged to be awarded that grant, to be able to be a principal investigator for the sub-study. So the sub-study really looks at these participants, and it follows their trajectory at 6 months, 12 months, and 24 months postpartum. And so also looking at, measures of depression, anxiety, and stress, but also thinking about maternal infant attachment, and then also the mothers that are lactating or breastfeeding, looking at breastfeeding self-efficacy. And so it has just been amazing, not only as a nurse that worked in maternal infant health and then also a mother of 4 children, but as a PhD student. And VCU was just really amazing to be able to have these, really immersive growth opportunities. So anyways, I know I probably spoke a little too long.
That's okay. It's perfectly fine.
Yeah, it's pretty fascinating. So, and really, this question will probably pop up a little bit later, but these opportunities really can present in many different ways. And so I think that it's just really, really important, whether we're in the PhD sort of trajectory, and my trajectory is biobehavioral neuroscience, whether we're in that trajectory or not, we can also think about, beyond bedside nursing. Bedside nursing is critical and instrumentally important, but also thinking about how can we help to grow and develop the state of the science, our nursing profession, and evidence-based practice. And so, there's always those opportunities to find, and research really will welcome nurses with open arms.
That's so cool. I can't wait to hear about the results of this study. It sounds really fascinating. So you've held leadership roles in both clinical and academic settings. So what leadership lessons have kind of stuck with you the most?
I would say that transformational leadership, I feel like is really significant. And I know that maybe sounds so simple, but transformational leadership for me is very heavy laden with just really being conscious about our actions, our words, the way that we actively listen to others, and the way that we demonstrate empathy and just respect for others in and of itself. And I'll say that also just really thinking about, we have to, as leaders, we have to think about the big picture, right? So sometimes we look at, for example, I was a nurse manager for 4 years at Sentara Williamsburg Regional Medical Center in their labor, delivery, recovery, and postpartum unit, which was the unit I was a bedside nurse in for about 6 years before I transitioned into that managerial role. But also I was an interim manager for their emergency department for 6 months, and I was also a bedside nurse in that unit. And I really think that is critical, to really think about everybody within the team and how important each and every one of their roles and their voices are, and really creating a space for them to feel comfortable to talk about, these things are working well, these are some opportunities, and really, thinking about, okay, so how can we do what we can do to make this work? There may be some things that we're not able to, really change, but so much so, requesting a higher budget, that may not be feasible, but really meeting people where they are and really being a transformational leader and inspiring others by example. I think that is really critical. And I've had some phenomenal leaders that have really done that. I will say, of course, Dr. Patricia Kinzer has just been phenomenal in that. At VCU, but even at Sentara Williamsburg, Jamie Carroll, she was the director that I had when I was the manager, and she just really led by example. And she's been and I think she currently still is, the nurse executive at Sentara Norfolk General Hospital. And so she has just, like, her leadership trajectory has just really grown. But anyways, just really thinking about that. And when we have really good leadership or mentorship, I feel like innately it makes us want to be better, right? Yeah. So I think that's really important.
That's really true. I definitely agree with that. So you've held, or what's your approach to mentoring, like not just new nursing, like faculty who are either under you or even students, or when you were in bedside nursing and in that manager role, people who came after you. Kind of what is your approach to that, and why is mentorship so critical?
So my approach to mentorship has evolved over the years, over the
Sure.
past 22 years, I feel like, and sometimes it changes or adjusts depending on who I'm mentoring.
Right.
So for example, I, as a more of a higher level PhD student, I have at least one or two PhD students that I'm mentoring currently, or as a sort of I'm going to say seasoned. As a seasoned educator, I have at least one educator at VCU that I'm currently mentoring. So kind of thinking, or in the research realm, I have a couple research assistants that I have mentored. So really thinking about that, I think that remembering that where they are and really seeking to learn where they are, but also helping them to understand some of those key facets of, as the mentee, these are some things that I need you to be to really kind of bring to the table when we get together and we talk and we collaborate and those types of things. And these are things that I, as the mentor, will bring to the table. And so I think that that's really important. So for example, the mentee being able to say, okay, I just need you to be very transparent with me where you're at in this moment in these certain things, right? And so by being transparent with me about that, I, as the mentor, can look at kind of the bigger picture and say, okay, I see that you're here in this moment, and this is where we need to transition to. So these are some of those steps that we can take to be able to do that. And sometimes it's just as simple as thinking about, I have, for example, the educator that I'm mentoring through VCU, and she's just such a phenomenal educator and has such a rich, diverse background. And so really talking about, okay, so we're looking at scholarship service, for example. And so we're talking about that a little bit. And so they say, well, in scholarship, I'm really strong in this particular area, but I would really like to get more involved in some sort of maybe international service. And so then we talk about that a little bit. And it just happens that I'm the treasurer for the Gamma Omega at Large Sigma Theta Tau chapter, which is Virginia Commonwealth University School of Nursing, VCU's Health Professions School, and then also Bon Secours School of Nursing. And so then when I'm talking to them, I say, well, you know what, there's this opportunity. Have you ever considered Sigma Theta Tau? Let's talk about that a little bit. And that really has an international reach. And these are some really great benefits. And there's an opportunity where you can get involved in maybe helping to facilitate CE events for other nurses, or, philanthropy and those types of things. And so really, being able to share those ideas and creating space for that. And then if it's something that I don't know, I'm very honest about that. I'm not really sure about that, but we can partner together to figure this out. And so I think that that's important. But also another key piece of mentorship is just, I really feel like being open and letting your mentee know, I am here for you, and let's celebrate your growth. And let's see where can we, continue to transition and those opportunities for improvement to help you grow. And I think by doing that, we as mentors grow too.
Yeah.
And
absolutely.
we learn so much more. And so it's really a way, I think, also of being able to pay it forward.
That's awesome. That's really cool. So how do you balance your roles as a researcher, an educator, and a leader within professional organizations and committees? You wear a lot of hats. So how do you balance all those?
So I would say really thinking about, and this is something that I really grew to appreciate more so working in academia within a university, with VCU School of Nursing, thinking about teaching scholarship and service, that tripartite, and how they relate to each other and how they intersect and overlap. So I think that that's really important, but also thinking about how we can collaborate with others to really, strengthen those relationships and that leadership. So, for example, just really thinking about, in the realm of research, my phenomenon of interest, that perinatal mental health and maternal infant dyad, or that sort of couplet, meaning dyad, those outcomes, right? So thinking about that specifically in the realm of maternal infant attachment and breastfeeding self-efficacy. So thinking about that, but then I also think about that in teaching, and I'm like, okay, so I have the opportunity to teach women's and infants clinicals, and then I also teach pediatric clinicals. So how can I thread in some of these things that I'm learning in research and connect it with what students are learning within that clinical realm, right? And so also thinking about that in service. And so for serving as a research assistant, being able to, serve in Sigma Theta Tau, how can I, bring to life some of that research, and really thinking about, we've talked in our chapter about having opportunities for, DMP or PhD, or even, master's and undergrad nursing students or scholars, being able to really showcase some of the research, or even if it's like, if they're doing literature reviews and those types of things, to be able to really showcase that maybe through poster abstracts or presentations, those types of things. And really just thinking about that they don't, leadership or even involvement within those different realms doesn't operate in silos. They're interconnected to each other. But I think sometimes we just have to be really creative, but also motivated and passionate about how can we bring these different connections to life, and how that can really benefit our profession and the students that are, arising to the nursing profession.
That's awesome. Yeah, kind of able to connect all those different parts. It just sounds really cool. So what advice would you give to any nursing students or new grads who are considering a career in either academia or research?
So, oh my goodness, that's a great one. I would say really doing some soul searching about what you are passionate about. And I know that sounds so simple, but if it's something that you're really passionate about, regardless of the ups and downs, the roller coasters that you experience, then you're still going to be motivated. You're going to wake up, you're going to be motivated, and you're going to be passionate about that. And I think that that's really important. The other piece I would say is it's never too soon to start engaging in exploring, academia or exploring research, or both. So I would say for those that maybe are nursing students, when you're thinking about, for example, academia, just really having an opportunity to say, hey, I have really enjoyed this clinical experience. I have really enjoyed the ways that you have brought to life this learning and connecting what we're learning in classroom and lab simulation and clinical. And I'm interested in this. Like, how did you start your journey into academia and creating space to be able to have those conversations with the students? I think that that's really important because, the workforce, especially when we're thinking about nursing faculty and even within the research realm, is not as robust as it could be. We have a lot of nurse professionals, and they are retiring, or maybe they're exiting the profession, and that can be just, we really feel the effects of that, I feel like, in our profession globally. And so I think that that's really important, but also in research. So we recently had what we call a PhD immersion at VCU School of Nursing. And so we had like a small panel of PhD, either graduates or students. And I had the privilege of speaking on the panel. And one of my greatest mantras is that certainly being aware of your bandwidth, what you're able to do, what you're not able to do. And sometimes that can wax and wane depending on your work schedule, life schedule, or what is going on in life in general.
Right.
And what's also going on when you're in school, right? Or if you've graduated and you're, immersed in research, but really thinking about how can I get plugged in or involved? And I know that JMU does a phenomenal job with that, and they have some robust research studies. I don't know all of them, but they have some really robust opportunities. Yeah. And just being able to say, hey, I'm a nursing student. I really enjoyed my pediatric clinical, and I'm looking for any sort of opportunity that I can get plugged in, whether I'm learning qualitative interviewing and I'm doing some qualitative interviews, or if I really like statistics, right? And so I want to help maybe learn more about data analysis and those types of things. Just really not reserving or holding back because, I'm a nursing student, maybe I'm not qualified to do that. Like really broadening your horizons and being brave and vulnerable to say, I really don't know a whole lot about that, but I think I'm really passionate about that. And I'd like to be an active participant in this journey.
That's awesome. That's really cool. So what keeps you, motivated and passionate about nursing after more than 2 decades in the field?
Oh my goodness. Well, I will tell you that I knew I wanted to be a nurse, and I kind of feel like nowadays this is maybe somewhat of a rarity, but I knew I wanted to be a nurse when I was very young. Mm-hmm. And I really didn't have any nurses in my family other than my great aunt. And so anyways, I will say, I think that just really the countless opportunities, whether it's bedside nursing, academia, research, there are so many, just a plethora of opportunities to get involved in. And if there's ever anything where you're like, I'd really like to transition and try something different, there are just so many opportunities to be able to do that in the nursing profession, which is truly a gift. Mm-hmm. And I think that in and of itself, and being really able to see how things evolve over time and how that they change over time is very inspiring as well.
Yeah.
And so but one of the biggest things kind of where I'm at now in my life or experience as a nurse is thinking about the impact, even if it's small, even if it's just maybe in one particular area. So maybe that perinatal mental health, maternal infant attachment, breastfeeding self-efficacy, that being able, if I'm passionate about it and I work really hard at that, then once I graduate with my, PhD, then I have the ability to really propel change, to really grow and develop the current state of the science. And thinking back to what I talked about earlier, how can I make a large impact?
Right.
And I think that for me, that's just been very inspirational.
Yeah. Yeah, I can definitely tell that you're super passionate about nursing. I love talking to people that, absolutely love their jobs and they love what they do, because it kind of, you can tell. So it's really cool to see. If you could go back and give your younger self one piece of advice when starting out, what would that be?
Oh my goodness, that's a great question. I would say, really, I would say probably try to get involved earlier in branching out into different opportunities. So really thinking about academia or research. I love both, but I think that I probably, like if I had to gravitate to one or the other, I think the research would have really been instrumental in thinking about like, how can I get plugged into that earlier? And I feel that way because I've learned over the course so far. I started the PhD program in the summer of 2023. So I've learned over the past couple of years that there are so many instrumental roles that individuals, based on their experiences and what they're passionate about, can really bring to the table in research. And back then, 22 years ago, I thought, I have nothing to bring to the table. You know what I mean?
Yeah.
But I could have done that, and I should have done that. And so really putting behind self-doubt and not getting immersed in that, but also really just being more vulnerable in a safe space to be able to say, I'm interested in this. I would like to know more about research, but I'm not an expert in it, and being okay with that. Right. And so being able to just kind of take that step, and I would be very sad or just, dismayed to know that someone, maybe a nursing student out there, right? Or someone, even if they're not a nursing student, nursing professionals listening to this podcast, and self-doubt, or, I'm not at a place where I could bring any meaningful contribution. Don't let that hinder you. Don't let that hold you back. I think that we all have a unique story, and we have unique lived experiences, and we all have something that we can richly contribute to the nursing profession.
Yeah, absolutely. And you kind of hit the nail on the head of why I'm even doing this podcast in the first place, is because I think everyone has a story, and I love sharing people's story and giving them the opportunities. So I think that's perfect. And kind of just to wrap up, if you had one message to leave with any current students listening, what would you say?
I would say try to really enjoy every day of your journey at JMU. I know that undergrad nursing, and progressing through the curriculum is very rigorous, but it will be so rewarding when you cross the threshold into the nursing profession, and really try to think about that positive impact, regardless of whether you realize it or not. You have the utmost capacity to make a positive impact in someone's life, in their moment, in their experience. And I feel like I talked about this briefly during the white coat ceremony, to kind of, I guess, bring it back full circle a little bit too. That they may, people may not remember your name, but they're going to probably remember the way that you made them feel, or the impression that you left. And so I say that because there was, when I worked as a labor and delivery nurse, there was a patient that I took care of, and just had a beautiful birthing experience. It was so wonderful. And then years later, that individual reached out to me this was a while back, right? So it was through like instant messenger, and just said, hey, Leslie, I don't know if you remember me, but I remember you. And you were there when my baby was born, and that experience propelled me to become a nurse. And I just wanted to take the opportunity to tell you that. And I'll tell you, Caitlin, that was probably one of the most rewarding things that I can say about, being a nurse for 22 years, is when people come back. And as nurses, we don't hear that enough. I'll be very honest with you. Sometimes everyone needs to hear, or experience positive vibes, and just know that their experience, or the impact or impression that they've left on others, has really made a positive impact. But I will say that would just meant so much to me, that they took the time to reach out to me to say that. And I just know that as future nurses, that even where you're at in your academic pathway now, you are making positive differences in others' lives. And so you will have the opportunity to be able to really continue that. And we can learn a lot from our patients. They learn from us and we learn from them. And not only are we learning about them, their diagnosis, their treatment, those types of things, but really we're learning about life. We're learning about, how to really respect and embrace others. And I think that that's really important too, as we grow, not only professionally, but personally.
That's so sweet. I'm so glad that they reached back out to you, and that's such a pivotal moment, I'm sure, in your career.
Yes.
Well, thank you so much for joining me. I really enjoyed our conversation. This was so much fun.
Well, thank you. I enjoyed it as well.
Thank you so much for joining us on this episode of Practice Makes Purpose. Leslie's story reminds us that nursing is a calling that can lead to leadership, advocacy, and meaningful change in healthcare. If you enjoyed this conversation, be sure to follow or subscribe wherever you get your podcasts. And if you're a JMU Nursing alum with a story to share or know someone who is, reach out. We would love to hear from you. I've included ways to get in contact with us in the description. Every nurse has a story. Thank you for listening to this one today. See you next time.